know that cancer can be detected early? Do you know that cancer can be treated effectively too? And that is with precision diagnostics. Well, if you want to learn more about precision diagnostics, today is a very special episode because I have a very special guest who's expert in diagnosis. If you don't know me yet, allow me to introduce myself. My name is Wanda Lintan Kalupig. I am the 2021 number one most influential Filipina on LinkedIn and 2023 top 15 LinkedIn expert in Dubai. Welcome to the Cancer Conversations podcast with Coach Wanda. Every week we go live on LinkedIn and we simultaneously stream this podcast live on Facebook, YouTube, Instagram, and Twitter because our goal every week is to share life-saving insights so that cancer patients and their families can get strength and support. And also, of course, we want to raise awareness because according to statistics, 1 in 3 women can have cancer in their lifetime, and 1 in 2 men have that risk too. And with cancer being the second cause of death globally, we're on a big mission to change the story. And if you didn't watch the previous episodes, let me do a quick recap of the previous episodes that we had on the Cancer Conversations podcast. On our first episode, we're very blessed to interview the number one and the first UAE National Emirati breast cancer surgeon, Dr. Hure Kazim. We spoke all about breast cancer on this first episode, and Dr. Huria shared how mammogram is very important, specifically for women over 40, to make sure that breast cancer is detected and treated early. On the second episode, we get generally 100 to 400 people who registered on our event on LinkedIn alone, but on other social media platforms, we do have listeners too. On the second episode, we had a guest, an integrative doctor who for the last 20 years have helped over 20,000 patients heal. And he is also helping cancer patients heal holistically. And Dr. Romy shared how you need to handle yourself physically, mentally, emotionally for you to get healed. You can go to wellnessland.org to check about his program on how to heal cancer holistically. And of course, you can go to Linktree Coach Wanda to get access to the recording because you can find the link to the YouTube channel, to the link to the other social media episodes that we had. Now, on the third episode, we had a cancer caregiver, one of our staff, Rose, is managing the cancer successfully with the husband for the last 8 years. Here, Rose shared how you can navigate the emotional journey of cancer. So together as a family, you can thrive regardless of any sickness. So go to Linktree Coach Wanda to watch the recording. On episode 5, we understood how every sickness is related to emotions too. And Coach LJ decoded and explained how every negative emotion that we have translates to sickness and how we can process those negative emotions to make us feel better, peaceful, and of course, stress-free. Go to Linktree Coach Wanda again to watch the recording of that episode. On episode 5, we have a very special guest from Australia. George had cancer at 31. Everything in his body had cancer except his bone marrow. But what's very amazing with George is how he reversed cancer and healed from it, even if he had a brain injury also at 39. Now at 48, he is the happiest, healthiest version of himself. You can go and watch the recording of the story of a cancer survivor story, Conversations of Hope. George shared a lot of tips, tools, and techniques you can immediately apply now so you can create that happiest and healthiest version of your life. Also, episode is another, I'll say I'm very excited because this is another life-changing episode with Liwa. He's actually from Saudi Arabia, but one of his projects is Taj Pay. Taj Pay is like the Tabi of healthcare payment. You can split your payments with 0% interest in Jordan because Taj Pay is transforming healthcare payments because cancer cost is generally 10,000 to 200,000 annually. But Taj Pay is changing that. So watch the recording of this episode. Another interesting episode, BioArrow. This is a guest from Canada. Dr. Kapoor shared how their advanced testing, liquid biopsy, and genome testing, and many, many more are transforming cancer diagnosis and treatment. So please watch the recording of this episode also to understand how there's so many technologies now that's available to get cancer prevented, detected, and treated. So, next episode, wow, I also had a guest from the US. Janita Green is a two-time breast cancer survivor. Again, for Janita, I think what's most powerful about this episode, she healed cancer holistically, surviving it twice. And she's a bodybuilder too. She lost all her muscle strength, but she was able to recover everything and now build a thriving life. So please watch the recording of this episode too. On one of the episodes also, we interviewed Dr. Neil. He's a palliative consultant who explained how palliative care and consulting is not only for the dying, it's for every person who wants to ease the suffering, to relieve the pain. And I think what I love about this episode is how Dr. Neil explained how palliative care helps patients and the families cope up with any sickness, not only about cancer. So we would like to thank, we had over 400 people who registered for this event. And again, go to Linktree Coach Wanda to access the recording. Now on episode 10, we spoke about cancer care in the Philippines and how you can find the best and high quality doctors. You know, what I love about Doc Dengue, she said, cancer is called a big C because it's so complex and there's so much that needs to be done to make sure you need the right care, the right people at the right cost. So go and to the Linktree Coach Wanda to access the recording. Now, one of the best episodes also is we spoke about insurance. We spoke how cancer cost is very expensive. And as early as now, it's so important to invest in your health by understanding what is the type of insurance that you need to make sure that you ease yourself and protect your finances from every burden of cancer care or any critical illness for that matter. Go to Linktree Coach Wanda because here we have two guests from Dubai, one from insurancemarket.ae and another person who's an expert in life insurance. So understand more about insurance, how to protect your finances on this episode. Well, on our last episode, we had another cancer survivor. I love, how Yasmina explained cancer is never a curse. Cancer is about finding hope to change your life. She explained on this interview how the journey of cancer helped her become a healer through hypnotherapy. So please go and watch the recording of all of these episodes on Linktree Coach Wanda. Again, we would like to thank our guest, our podcast sponsors for making this podcast possible with Bailiwick Academy and Carlton Social Media Marketing. Now, without further ado, I'm very excited because our topic for today is about precision diagnostics, the key to early detection and targeted treatment. Let me first introduce my guest. Dr. Anthony Thomas is the Director of Diagnostic Services at Prime Healthcare Group and a specialist pathologist at Prime Hospital and Premier Diagnostic Center in Dubai. With a focus on clinical pathology, Dr. Thomas plays a key role in advancing diagnostic healthcare in the UAE. He also serves as the Vice Chairman of the Medical Diagnostic Board at the Dubai Chamber of Commerce, contributing to the development of the medical diagnostic sector. And he's also a seasoned technical assessor for ISO 15189 accreditation, conducting assessments across the UAE, Kenya, India, Mongolia, and Nepal. And as a technical advisor for the Emirates International Accreditation Center in Dubai and an inspector for the College of American Pathologists, he has extensive expertise in quality assurance. Additionally, he trains professionals under CLSI and ISO 15189 standards, helping set high benchmarks for laboratory excellence globally. Wow, that's quite a profile. So without further ado, let me bring Dr. Anthony on stage.
Thank
Hi,
you, Wanda.
Doctor.
Thank you, Wanda, and thank you for that nice introduction. It's really
Thank
good.
you, Doctor. It's an honor to have you. I think, I'm very excited because there's so much in medical terms that I don't understand, which I think you can bring so much light today. Number one, Doctor, maybe you can tell a little story first in terms of, what brought you to pathology. I mean, I've met so many doctors by now. And I mean, I know how doctors have very complex studies. Now, what brought you to pathology then? Can you share a bit of story first?
That's a very interesting thing to discuss. See, like any other doctor, I also wanted to be in the clinic. That means directly dealing with the patients. That was my ambition also while my studies. Meanwhile, after the exam, yes, I got into pathology, and it's very difficult to get into any specific field. So got into pathology with very little interest. I ended. I have to admit that. Very little interest I had to join that department. But after joining, the scenario changed. We had a lot of interesting, very good professors. In fact, that they are the ones who makes real change. And one of my professor was a hemophiliac. He was affected with hemophilia, and he was working for the care of hemophiliacs. And that is the initial stage where in which I started working definitely on pathology. So for the diagnosis of hemophilia and other bleeding disorders, coagulation disorders. So from that onwards, slowly we get, I can say, married to pathology. And then towards the end of it, the 3-year course plus additional experiences and so on, at the end of it, in the same department where in which I joined with little skepticism, I passed out with a gold medal. And see, that is, I feel it is, once we get into that field specifically, you will slowly get attracted to that, and you will develop attention to that. And pathology is the one that stands behind the clinicians. That's what we used to say. It used to stand behind,
Mm.
but it is not. All the around 70% to 80% of the clinical decisions for treatment is taken based on the reports which we generate, either from the
Wow.
laboratory or from our anatomic pathology division. So it based on all this. This is how the diagnosis goes, and from that goes the treatment decisions. So this is in brief about the pathology
Thank
division.
you for that, Doctor. I love what you said. I married. I think we become married to our professions, right? And I think being married to pathology, I agree with you. I think by now, I mean, after meeting so many doctors, I understood how there are different kinds of doctor. But I agree with you with what you said that, pathology doctors, the reports that we produce are actually the ones that help in terms of decision making, because I've seen how, in every treatment there's also like, where's the report, what does it say, because the decision of the doctors, the oncologists, will depend on the reports of the doctors, and those are pathologies. No, doctor, there's pathologies, there's medical diagnostics, there's are like, terminologies, but what is medical diagnostic, and then in relation to pathology, what is it?
Pathology is the science.
Hmm.
Logy means the science.
Okay.
Pathology and pathos means those who are suffering. So the science
Oh.
of suffering. So that
Oh,
is pathology.
wow.
And
Hmm.
from that, the diagnosis comes. Only when we evaluate the science of the cause for suffering, then only we can come to a diagnosis. That is why both are not separate. They are two sides of the same coin.
Oh, wow. I learned something new today. Science of suffering. That's why, I learned how every sickness can only be solved with the root cause. And if pathology is about the science of suffering, then that makes it even more meaningful and important. Now, doctor, I attended one of the sessions in Al Jalila Foundation, and one of the doctors said that there's so much challenges in cancer because there's so many diagnostics that's available. Not every cancer can be detected also by test. Now, doctor, can you expand more about this? I mean, it's it's something that's so technical. Can you explain more what diagnostic is and how it helps in terms of detection?
Okay. It's quite complex if you see everything together,
Yeah.
but you have to take one step at a time. For
Hmm.
example, if you are looking for screening test
Mm-hmm.
for specific common cancer only, we have screening test. For example, cervical cancer of in a woman or a breast cancer in a woman. In men, when it comes to men, it is a prostatic cancer in men or a smokers lung cancer, then colorectal cancer and thyroid carcinoma in adult age group. Okay, so basically you have to see the common cancer. This forms almost the common cancers. So for the
Hmm.
cancers, we have some screening programs and screening tests available. For example, for cervical cancer, we have the almost 150 to 200-year-old pap smear screening, which,
Oh.
which the woman undergoes. And
Mm-hmm.
then in a normal woman without any family history of any cancer, they need to follow up for the breast cancer. Those who do not
Hmm.
have a family history of breast cancer, mother or close sister or close relatives not having breast cancer, then after the age of 35 and 40, then they come into the spectrum of screening. Not that
Hmm.
one age group it comes. Meanwhile, at the same time, if there is a family history of any breast cancer in their close family members, then they have to start at a younger age group.
Hmm.
So, likewise, now when it comes to prostatic cancer, yes, 50-year-old men onwards, we focus on prostatic cancers. Colonic cancers, the guideline is that every person who has completed 50 years, after 50 years, you need to undergo one colonoscopy, okay, and if there
Hmm.
are symptoms, endoscopy. So then follow up based on that result. Meanwhile, another totally common, especially among female, is the thyroid papillary carcinomas of the thyroid.
Mm-hmm.
This is generally you will not see any. It is in the the thyroid gland is located in the
Yeah.
neck region in the
Mm-hmm.
base,
Mm-hmm. Mm-hmm.
and 90% of thyroid carcinomas there will not be any symptom,
Oh, that's scary.
not
Hmm.
any symptom, and the
Mm-hmm.
thyroid gland will be of the normal size,
Uh-huh.
and all the hormones will be normal in them. And for any other reason, when they do a ultrasound, that's the time they diagnose. And unfortunately, there is still no specific guideline for screening for thyroid cancers until and
Hmm.
it is followed up or for and incidentally it is detected most of the times. And by the time a lesion comes or metastasis comes,
Mm-hmm.
it will be at a little later stage for diagnosis.
Oh, I understood now, doctor. Thank you for unpacking that big question. I think, now I understand because, people said do this screening, this and that, because I think there are many types of, I mean, based on your explanation, is that there are many types of cancer, there are many types of screening that needs to be done depending on the age, the history of the patient. But we also need to be aware that there are still several types of cancer, like thyroid cancer, where there are no specific screening to detect it. That's why it's kind of difficult to do that. Thank you for that. Now, doctor, maybe you can give a lot of people now are majority of people who are unwell are scared to go to the doctor because they're afraid of being diagnosed with sickness. Now, but also there's what they always said, prevention is always better than cure. Can you share a bit of story in terms of number one, a success story when a patient was diagnosed early because of screening, and number two, in terms of suffering because it was already felt in the body, but there was delayed detection because there was delay also in terms of the screening. Can you share a bit of story, doctor, from your experience?
Lot of stories is to this thing. Probably when you mentioned about a story, it's something a female of almost 45 years old. She came to us. We do a procedure called fine needle aspiration cytology of the breast. Okay,
Mm-hmm.
there is one of the simple methodologies using a small syringe. We try to collect some material. In fact, we were not suspecting any cancer in her. And in breast, the better methodology is true cut biopsies, not the fine needle aspiration cytologies. Fine needle
Mm.
aspiration cytologies are commonly done for the thyroid lesions now, currently. But in her, we were not expecting a cancer, and then we have done FNAC in that, and it was in FNAC. Unfortunately, what happened was that's the time the COVID came and the lockdown, and she went to her home country for some reason. And
Oh.
then by the time she came back, it was almost 1.5 year over.
Hmm.
And that time, then we immediately, by then the cancer was grown big enough to do a biopsy and so on. Because, the
Mm.
tumors, the breast and all, there should be a minimum size of almost zero point 0.8 centimeter to 1 centimeter. Then only, around 8 millimeter to 10 millimeter. Then only many a times it is quite, it will be detected by the person. So by the time itself, when she came, it was in something in that level.
Hmm.
When she came back, it was almost 1.5 year or 2 years over, and by then it had widespread metastasis across the body.
Hmm.
Now, see, now comes the role. We have done the biopsy at that period, and then we have done histochemical markers called ER, PR, and HER2. In her case, ER and PR were negative, and HER2 was positive. Okay, so this is some technique, some immunohistochemistry, some chemical methodology, some genetic test methodologies, all those things which we follow or we are trying to diagnose. Since generally ER and PR positive means very good response to treatment.
Oh. Hmm.
And HER2, 30 years back, there was no specific treatment.
Wow.
Now there
Hmm.
is, now see what happens in the over 30 years. In 30 years time, HER2 is also into the same level. HER2 positive also, we have very good treatment options. She underwent that, and now totally she is free of treatment, and she is still following with us. So this is happening. But the same lady, if it would have been 30 years back, if there would have
Yeah.
been, there would not have been a treatment choice, or the treatment would not have been that effective. And it is not only in the cancer field, everywhere the things are changing. For example, obesity, 10 years back, we used to think of bariatric surgery when the
Hmm.
diabetes fails. Now we have, Munjaro is there, so we start thinking in that line. And in another 10 years' time, the bariatric surgery may totally disappear also if the clinical trials or the result which is coming out with Manjaro is very promising. In another 10 years, we may stop doing bariatric surgery, or soon we may stop doing the bariatric surgery. So things are changing very fast for good.
I like what you said, Doctor. Things are changing quickly and it's for the good. And I think, I was trying to recall the interview with Dr. Huria, our first episode. She said, yes, it's bad news that cancer is common now, but the good news is that it's getting detected early and it's getting treated more effectively. And I think that example that you gave of, if that person was there 30 years ago, there's no even way, that test didn't even exist, right? But I think with the advancement in technology and treatment, you can also do, I mean, there's so many tests that needs to be done, but I think the good thing about the further test is about now what kind of treatment can you give to the patient. Now, doctor, I know the screening or whatever test needs to be done is helpful in terms of the detection, right? Now, in terms of the treatment, doctor, can you explain more? Because I know you explain a bit how that, R2, I lost track of the terminologies, but the terminologies you did mention, how knowing those numbers and those parameters help you now understand that, okay, she can take treatment, she can do this, she can do that. Because I also know one person from Australia, she got cancer, but she was allergic to chemotherapy. And can you explain what really is this precision diagnostic in terms of targeted treatment? Because that's another technical term to many.
Just before that, I like to explain a little bit on the, before we come to the targeted therapy, there should be a background. So I'll just
Yes,
explain that.
doctor, I love that. Mhm.
Is that okay?
Yes, yes, I would love to hear that.
Okay. Previously, the diagnosis of cancer is based on the morphology alone. That means the appearance
Mm.
of blood cells, appearance of cancer cells. So appearance of any biopsy which we have done, or a huge mass of lesion like whole breast, or a gastric specimen, something like that. Morphology alone was the basis. Then came the tumor markers. Tumor markers in the sense there are some hormones or so that increases, or that increases with cancers. For example, alpha
Mm.
CEA. Then the breast related some cancer markers are there. Liver related cancer markers are there. So likewise, these they are we call them as tumor markers. But unfortunately,
Mm.
they are not specific. It can be
Oh.
increased in numerous other conditions also. Okay.
Mm.
Now, before we come to the precision treatment, we need to know about precision diagnosis.
Yes.
Precision diagnosis is, in simple terms, I will just explain it. You take the
Yeah.
blood from a patient without,
Mm-hmm.
before he is diagnosed with a swelling or a tumor or a clinical condition, you take the blood and evaluate. Now, normally, the general perception is that within the whole blood there are cells, the tumor
Mm-hmm.
cells. I mean, the normal blood cells are there. In addition to that, there can be tumor cells also, and you detect it. This is what, when we say, diagnosing something with the blood, means this is what we have it in mind. But now there are something called as cell-free DNAs. It is
Wow.
not that the whole cell of a tumor that is there in the body. There are, from the tumor cells, these DNAs can be released from the cells, and they are plenty going around in the blood vessel, within the blood.
Mm.
So these cell-free DNAs from a tumor, we can that will be helpful in diagnosing. If I have to tell something about in more in detail, in a pregnant woman,
Mm-hmm.
if the baby is having a chromosomal abnormality like trisomy 21 or so,
Mm-hmm.
need to do anything. We don't need to biopsy a baby sample to or a chorionic villus sample to diagnose this. From the mother's blood, if we evaluate, there will be cell-free DNA from the baby. So with that, that is
Oh.
called as NIPT now, non-invasive prenatal.
Mm.
So with that, with the cell-free DNAs help us to diagnose, okay, the baby is having Down syndrome or some other kind of genetic abnormality. Okay. And what kind of decision need to be done, we can take up like that even without getting into the womb of the mother. So that is the precision diagnosis aspect. Mm. But the challenge when it comes to precision cancer is, within our body, lot of mutations are taking place. The cancer forms from a mutation.
Mm.
A normal cell, a genetic material, get mutated to a cancer cell.
Mm-hmm.
And this is happening every day in our life with a lot
Oh.
of chemicals, pollen, lot of toxicities, aging is another factor. Then our habits, chronic smoker,
Mm.
passive smoker. Then our, if it is cervical cancer, from our sexual habits, having multiple partners, or unprotected cells, HPV. So all this can cause. We are exposed to various mutations, but the
Mm.
blessed with adequate immunity. So 99.9% of these mutated cells have been suppressed or destroyed by our immunity. You got it?
Mm.
Normal
Yeah.
person, if you have adequate immunity, a 90% of this or 99% of these abnormal mutations have been eradicated. I will say that cell itself will get
Mm.
eradicated. So the chance for growing is to becoming a cancer is very limited. Meanwhile, once they escape that immunity, then they grow into a tumorous mass. You got.
Mm.
But with precision diagnosis, what happens is in any of this stage, in the you can detect these kind of these kind of the mutation, cell-free DNA through this thing we can detect. But sometimes our immunity would have taken it over and would have.
Mhm.
One classical example is Angelina Jolie's case.
Okay, that's interesting. Yes, tell me, doctor.
Angelina Jolie. She has she has a specific gene called BRCA, breast cancer. That is called BRCA gene is there.
Mhm.
She has inherited from her mother. Her mother also had it. Her mother also had cancer. But some 10, 15 years back, the prevention is remove the organs which these mutations can occur. For example, breast.
Yeah.
She removed her ovaries. I mean, in fact, all her womanhood has been removed because of
Mm.
this thing. But today, there are ways to prevent by, you have mentioned about precision diagnosis as well as precision therapy. We can detect whether it is undergoing mutation and then remove that organ. That is a specific way. In addition to that, some specific therapy, gene-based therapies are possible in which we can reduce the chance for developing that into a cancer. Did you get that?
Ah.
This is like now, see, we talk about I'm sorry to say about the war going on. The missiles
Mm.
on one side that is blocked by the Iron Dome. You got it. Similarly,
Mm.
there are specific genomic therapies targeting the tumor cells. That is
Mm.
the second way. That is genetic therapy. The other
Mhm.
way is immunomodulators. You enhance the immunity against that specific tumor. That is
Mm.
also the other way around. Okay, so the second way you are going to immunomodulators. The third is
Mhm.
the viral modulators. Viral, the viral model. For example,
Uh-huh.
cervical cancer.
Mhm.
Cervical cancer, how it is spread? Do you know the causative reason for cervical cancer?
No, doctor, tell me.
That is by a virus called human papilloma virus, which
Uh-huh.
is transmitted during sexual intercourse.
Oh.
That is why early age of sexual intercourse, when we have a early age of sexual course, that will be with the wrong man because you are not mature enough to understand what is happening. A man with having a partner with multiple sexual partners, that is the second reason. And then the third
Mm.
aspect, so considering this kind of things, but now we know it is caused by a virus called human papilloma virus. And
Mm.
that can be taken care by a vaccination. So
Oh.
a child, a woman, I mean a girl who by the time she reaches her puberty, 13 years and so on,
Mhm.
3 or 4 doses of these vaccines over extending over a period of 1.5 years or so. Exactly, I'm not
Mhm.
talking because I'm not the one involved in that. You have to consult a gynecologist for that. Our gynecologists are you know, this, take care of this thing. And that can prevent the development of cervical cancer to a great extent.
Oh, wow.
But see, unfortunately, all the vaccines, everything is forced upon the woman, and
Yeah.
the causative reason is a man. Okay, and we have not still not decided. There is no trial done on men for even that is going on. Give
Mm,
vaccination for men to prevent to safeguard the health of women. That's also ongoing. Some trial studies I have seen, but that is not successful much because we do not, it's quite difficult to study the outcome. Now, see,
mm,
any treatment and or diagnosis both should be based on the outcome. Ultimately, what you will gain out of it. A 75-year-old or 80-year-old or 90-year-old person diagnosed with a cancer, and
mm.
you treat that person unnecessarily with so many chemotherapies or so many other modalities,
Yeah,
ultimately what they gain. So it should be
mm,
outcome focusing on the patient.
true.
Okay.
Wow, doctor. I think I learned so many things today. I mean, I've heard of these tumor markers, but I didn't understood until now what it means. So I
Tumor,
mean, yeah, I mean,
tumor is
yeah,
about tumor.
there's so many things that you explained in I think that's, the medical term is so complex, that's why a lot of patients get overwhelmed with too much information, but I think you explained in very simple terms today how, precision diagnostic, precision testing, precision treatment is all related, because it's about, I've heard a lot of times also about mutation, metastasize, and I think he explained in simple terms how each of these are related to each other. Thank you for that. And I think, that's the fear of a lot of people, what do I need to do? And the way you explained how women age 13 or 14 or above needs vaccination also to protect themselves from cervical cancer. That's something that, I mean, that is very good for people to know. And I think, I know one of the doctors I interviewed, Dr. Romy, spoke about there are two reasons why we get sick. It's toxicity and deficiency. And I think when you spoke about the immunology of, enhancing the immunity of the patients is one of those things that really help patients get healed. Now, doctor, there's so many advancements. I mean, people always get lost. Okay, there's so many things I need to do. I need to to stop getting sick to prevent cancer from getting into your body. Now, doctor, what's your best advice? Because I know there's so many screening that could be done, that needs to be done. There's so many vaccinations you might need. Now, what's your best advice to people? It's not about being scared, but I think it's about, taking care of yourself. Let's take it from that perspective. What's your best advice to first a woman? I understood now with your explanation today how men and women have different risks in terms of cancer and what's causing that. What's your best advice to a man to make sure that he's taking care of his health? What's normal thing he needs to do?
I think we will divide it into three.
Okay, wow. Yes, doctor.
One is common, what we all need to do. That is
Yes.
second for women
Uh-huh.
and third for men.
Hmm.
Okay, so in
Oh.
this three, common thing is, there is a statement in Bible. It says that love your neighbor as you love yourself.
Mm-hmm, mm-hmm.
So whom we need to love first?
Ourselves, doctor.
Ourselves. So we need to
Mm,
love ourselves, and there are there are few things about ourselves. One
mm,
is proper regular exercise.
mm,
Okay. Physically we need to, and it increases as age increases, your time that you spend for exercise also should increase. And
mm-hmm.
another thing is the intensity you should reduce. For example, if a 60-year-old or
Yeah.
70-year-old, if you start running fast and trying to take 70 kilos, 80 kilos and all, it
Mm,
will break your bones. But
yeah.
you can spend more time and help yourself in terms of first the exercise for both man and woman. Second
Hmm.
is for everyone is stress management.
Hmm.
What happens with stress is with stress the hormones that the adrenal hormones that is against all normal functioning of our body. It is
Hmm.
against all normal functions of our body. So try to control and living, even attending to you now for this podcast also is stressful for me. We need to learn to daily stress, don't carry it for the next day.
Yes.
That is a second important aspect related to the
Hmm.
stress. And then commonly, what are our the habits, common
Hmm.
habits, the few things like cigarette smoking,
Yeah.
whether it is as but the problem with cigarette smoking is, see, for a cancer, to cause initiate a cancer, we call something as initiator, a chemical initiator.
Hmm.
Okay, it may be a viral mutation or so, but that alone is not sufficient. There should be promoters that what promote the cancer. So there is a
Hmm.
initiator and then a promoter. So something that initiates cancer, followed by that mutation, then there are promoters that promotes the growth of this abnormal cell. You got it?
Hmm. Yes, doctor.
So the cigarette smoke is a good soup of both.
Hmm.
It has both initiators and promoters in it. So preventing smoking, too much of alcohol.
Hmm.
In excess is poison. That always we need to keep. But when it comes to cigarette smoke, it is like cyanide. Irrespective of the dosage, it affects. It affects
Wow.
any of the system of your body, not only just cancer, the blood vessels, your heart, this thing, your brain functions, everything will be affected. Alcohol,
Hmm.
if you cross the limit, then that is highly dangerous. And
Hmm.
then another area of what else, that else will come in the habit, cigarette, alcohol, something else. You can also help me out.
The food doctor.
The food. Very good. Very good. Food. See, the food we consume, some of the food we consume, that the tobacco use those who use tobaccos. Okay,
Yeah.
that's another thing. Then the food, yeah, the food for every region there is a specific dietary pattern.
Oh, yeah.
Unfortunately, what happened was these patterns were designed when the people were more so working as farmers, either in farming or
Oh,
to
yeah.
work hard to get their daily bread.
Hmm.
Now, 99% of time we are sitting in a chair
True.
and working. So that food, yes, it is tempting, and it is very tempting. But unfortunately, what happens is that same habit may not be suitable at this stage.
Yes.
We
Hmm.
from Philippines and from India, we have the habit of eating three-fourths of rice and then the side dishes. So now it is time we reduce the size of the rice. I will not tell you to
Yeah.
reduce the size of the side dish, but the size of the rice should be reduced. The food. So these are some common factors which we need to make into
Hmm.
consideration. Then other thing is our habits, sleeping habits.
True.
Our sleep, rest is very important. So
Hmm.
how you rest? For millions of years, we developed our habits like to sleep early, except for soldiers and so on. We used to sleep by once the sun set, 8 o'clock and so on, and we get up by the time the birds also gets up.
Hmm.
He gets up. This is the normal diurnal pattern of an human being. Our hormones have been designed accordingly. But
Mm.
nowadays, what happens is because of the changes in our this thing, nightlife has started, internet. Then some people also the nurses night duty, doctors night duty. So all IT profession night duty in and the world has become a small village now. So the people here is
True.
working midnight to match with the
Mm.
American and rest of the European timing. So all these have plays a role. So whenever or whomsoever can sleep early, learn to sleep early and try to get up in the morning. So that in common, general for everyone, these rules will help to prevent. I am not saying prevent cancer, to be more healthy in life for all. Now coming to women,
Yeah.
first and foremost, why breast cancer is common? I have already mentioned about cervical cancer, the reason, and so on.
Mm.
Why breast cancer? Why ovarian cancer? The other many areas. It is related to the hormone.
Oh. Mm.
So how you maintain your hormones appropriately? On an average, if you see, a woman will have, let's say, a woman with in a 28-day menstrual cycle. That means
Mm.
in a year, there will be around 13 to 13 menstrual cycles in a year, average. Am I right? In a reproductive age group.
Correct. Correct.
So normally what happens is 3 to 5 days they will be affected with menstruation.
Mm-hmm.
Normally it is 3 days, but some those people who don't follow regular exercise, obesity, this thing, it will increase to 5 days. Okay, so average 60 days of their life in a year, 60 days it has been affected with the menstrual, the problems associated with, I'm not saying problems, the
Mm.
discomfort associated with
Yeah.
menstruation is there in a woman.
Mm.
And let's see, that means in 60 to 70 days in a year.
Mm.
And if you see that for 10 years, if you take that period, it is 600 to 700 days. That means 2 years of her lifespan has been, in 10 years, has been affected with menstruation.
Oh
Did you?
yeah.
Did you?
Mm. Correct.
Yes.
Yeah.
Why? See, I would not have, as a man, I never realized till I get married and, I'm
Have
working,
children.
having daughters, everything. Then only I realized the kind of difficulty they are going through. But how to
True.
reduce that impact?
Mm.
One way is proper exercise, regular exercise,
Mm-hmm.
and follow the regular norms. Okay.
Mm.
This in turn will help you out in managing your hormones.
Mm.
And to a great extent, they will contribute to a better immunity. I will talk
Yes.
about immunity. I'm not talking about preventing cancer. It enhances
Mm.
your immunity. Once you have proper immunity, definitely it will keep the cancer at bay. Did you get that?
Mm.
Okay.
True.
It is
Mm.
not that there is no 100 percentage rule like that. It is not
Yeah.
practicable to explain anything, but multiple factors are involved in that way. Then
Mm-hmm.
what a woman can do, okay, depending upon cervical cancer screening programs are there. They have to follow
Mm-hmm.
that. Then after certain, if there is no family history, after certain age, after 35, after the age of 30, 35, self-examination of breast, that we can start. As you know, it does not require a third person's assistance, so you can do self-examination of breast. And breast is unfortunately, breast is one of the superficial organ in the body. But by the time we detect a disease or a cancer or so, it will be too late because nobody does a self examination.
Mm.
When you do
Mm.
self examination, you have to do underneath the armpit, the axilla.
Mm-hmm. Mm-hmm.
Breast has got a tail, breast tail, that extends into that area. That's also a common site for development of cancer. So you have to examine that area also. So this is related to the breast cancer area, screening. Then
Mm.
comes ultrasound screening till they reach 40 years. Ultrasound is
Yeah.
one of radiology, and then
Mm,
mammogram.
correct.
Then
There's so
mammogram.
many tests, yeah, doctor?
See,
Somehow.
you, you have mentioned earlier that the cancer is increasing. In fact, there are cancer is increasing because we are no more living like how our grandparents have lived
Oh,
some 40
yeah.
years back. We are no more
Mm,
like that. The toxicity level in any region we are living is increasing, and
true.
then and earlier the lifespan of a human being was around 60 years.
Yeah.
Around 30, 40 years back, or 40, 50 years back, 60 years was a, we used to call it as old age. Now we call old age only once they reach 90 years. Hmm?
Mm, yeah. We're
So
living longer also.
we are living longer, and
Mm,
you see, earlier by 40 years, people used to get a lot of wrinkles on their face. Now we have our methodologies to prevent wrinkles on the face. So all this, for a longer period we are living, and then the diagnostic modalities have increased. The
true.
diagnostic modalities have increased. So that is also another reason for now imaging wise, the lung cancer, especially in Japan, the lung cancer is one of the more lung cancer and stomach cancer. These two are the common over there. They have very good methodologies, less invasive methodologies, and some of them are invasive methodologies to detect early detection of these cancers. Hmm.
Mm,
And then very good treatment options also have been generated. That is why if there is no outcome, then don't screen for it. Not now there is a good treatment
there's
option.
so much good outcome.
Screen
True.
for it. So we completed common things, the factor with women.
Now
Then
the men.
and before going to the men, to the woman, see these days, I'm sorry to say this. Don't see me in a other end of the spectrum. See the feminism when we talk about. Some of the women at least think that feminism is about imitating men, like smoking,
Mm,
like smoking or drinking.
mm.
Unfortunately, based on the basic the body development and the hormone of the woman, the impact of smoking, either passive or direct smoking, as well as impact of alcohol, is more in a woman than in a man.
Oh.
The adverse
Mm,
effect is more in a woman than in a man.
mm.
Meanwhile, as long as they have their hormones, estrogen, progesterone active in them, the chance for developing heart diseases are very less. Have you
So
ever heard?
in
See, there are both side. There are good
true,
things
doctor.
based on the hormonal changes. There are good and bad in it. But
Hmm.
by habits, we are spoiling that goodness.
Yes.
You get that. So
Hmm.
this is another area. Now we will move into the men, and probably men commonly it is prostatic cancer.
Hmm.
Earlier, diagnosing a prostatic cancer was very difficult. There are multiple. There are benign hypertrophy of prostate is there, as well as prostate cancer is there. So diagnosing these two are very difficult. But now with ultrasound and examinations, and then there is a tumor marker. You earlier asked about tumor marker, prostate specific antigen. The tumor marker is there. That is very specific for prostate cancer, and that can differentiate benign as well as the malignant cancers also using this variants of prostate specific antigens. So in a man, that is one thing. Second area is another area is the lung cancer is more common in men because of the smoking habits and the exposure to the various chemicals in the workplace and so on. Hmm?
Hmm.
Automobile exhaust, everything. The lung cancer is another common. And meanwhile, gene therapy, with gene therapy, lung cancer is one of the area where in which they have advanced a lot in the clinical trials, gene therapies, that is,
Mm.
precision medicine is very good for the, especially non-small cell lung cancers. There is very
Mm-hmm.
good gene therapy, genomic therapy options are available now. Now, I mentioned our prostate, lung, and the other one is colonic cancers, colorectal cancers. Again, dietary habits are plays a role. Then the various inflammatory changes within the colon and this thing. Then there are general, genetically mediated, familial
Mm.
polyposis colon. So there are some familial conditions. So those people with family history of colonic cancer, from the age of 30 onwards, they have to undergo, or simple methodology is fecal stool for hemoglobin, presence of hemoglobin or blood in the stool is one of the simple methodology. In addition to that, colonoscopy, that helps. Meanwhile, in general, all those people who are aged above 50 years and have a colon, they have to undergo colonoscopy after the age of
Mm.
years. And in the first colonoscopy, if they are fine, then they have to repeat it only after 3 years, or and in that period, if it is fine, then they have to repeat it after only 5 years. So like I'm not talking. The year wise, it may not be very specific because I'm not the one who does that. So that is, but I'm just giving a overview of the colonoscopy screening for the adults in preventing colonic cancers. Then some of the cancers, only with symptoms we will, with some symptoms
Mm.
or incidentally. For example, when you are, for some reason, you have done an abdominal ultrasound and noticed a mass in the
Yeah.
pancreas, you are
Mm-hmm.
likely, okay, something like thyroid also, there may not be any symptom. And
Yeah.
then for some reason, you have done an ultrasound of the thyroid and then you noticed that. So either incidentally like that, we
Mm-hmm.
diagnose it, or with symptoms. It may be like a person developing a. I wanted to tell the story of one of my professor. One of my professor, he had he's a non-smoker,
Uh-huh.
totally a teetotaler in all aspect, and then
Mm-hmm.
he developed hematuria. That means blood. The urine turned out to be blood. The blood mixed urine. He started to pass.
Mm-hmm.
Then they noticed a mass related to the kidney and the urethral. This was almost 35 years or
Mm.
35 years back. This has happened, and then noticed abnormal cells in the urine.
Hmm.
Then we thought, okay, some renal system related disease. But further on working out, only then we realized the primary is in the lungs, and the lung cancer has metastasized to the different parts of the body.
Oh,
In
like that.
so
Hmm.
symptoms, when we diagnose it with symptoms, by then it may
Yeah,
be very
it's too
late.
late.
It will be
Hmm.
too late. So that is why the screening test and this general overview is important.
Hmm. Wow, doctor. I learned so much things today. I think you know what I learned about this episode is that there are many types of cancer, but men and women do have different risks. But what's important is that you love yourself, get yourself checked. Number two, you make sure that you manage your stress well because that way your immunity can, of course, eliminate the cancer cells. And of course, it's about the habits every day, the food you eat, the sleeping patterns, whatever you do, you need to be aware how your habits are actually affecting your life. Now, doctor, I know Premier have a lot of wellness packages both for men and women. Can you please tell us, and how can they get in touch with you? I think there's so much information. Maybe people want to know what's the best way to reach you, and maybe you can share more about the packages that's available in Premier Diagnostics.
Okay. First and foremost, Premier is a part of Prime Healthcare Group, and our taglines, from the time where in which we started with one principle: personalized care personally.
Hmm.
This is the 25th year of Prime Healthcare Group. And in 1999, when we started this, we had only 5 doctors
Wow.
and a nursing team to support with hardly around a 15-member team. That's what started with. And I joined as the ninth doctor in that group. So 22
Wow.
years with Prime Healthcare Group. Today, we are a group of almost 3,000 employees with
Hmm.
550 doctors. Plus, we have in Dubai, Sharjah, and Ajman altogether in these 3 regions. We have around 17 clinics. And in Dubai, it's a 17 clinics and altogether around 22 clinics. Then also spread in the corporate area and so on. In all these areas, we focus on personalized care. Personally, that is what is we focus on. Now coming to the Premier Diagnostic Center, we focus because this is a center where in which we provide both the laboratory and radiology services together. We
Mm-hmm.
are based here in Reef Mall of Deira, in the Reef Mall of Deira. Nearly 80 staff are based there, and we have the numerous our regular patients. On an average, we receive around 1,000 odd samples for the laboratory testing, and somewhere around 200 odd patients for the various imaging studies. This is what happens, and we have defined packages for every uh, every age group for handling the. It's not just about any cancer related alone, overall health related, and as well as we can get the help of dietitian, endocrinologist. All this have been included with some of the packages. So this is in general. Since this has been very well been accepted by the people, now we are working on building more premier diagnostic centers also. We started one in the Mirdif region, in the
Mm-hmm.
Arabian center. There is a premier diagnostic which is associated with the prime medical center in the Arabian center. So there also we cater to the various patients. Then another one we have started in Ajman, because in along with the prime medical center in Ajman. So likewise we are trying to help out. See, we are trying to serve the community in the best feasible manner possible. And also our doctors are involved in the regular training, and also our institution, also in our hospital, in addition to being focusing on these various healthcare areas. We also recently been accredited by the Dubai Health Authority to start various training programs, and we started for Arab board studies. We have started internships. We started giving, as well as residency programs have been started by a good team of our doctors. That's
Wow, doctor, that's quite a milestone. But I think 25 years personalized care personally and being the ninth doctor in the team, I mean, out of the 500 you have today. So thank you, doctor. We appreciate your time and wishing you all the best. And, for the last 16 years, I'm one of the patients of Prime Health Group. So thank you. And we look forward to guesting you again. I think there's so much, there's a big topic inside this topic that we discussed today. But thank you for sharing your wisdom today. Thank you, doctor.
Thank you, Wanda, and I really appreciate the way in which you have guided me, and each area you have concluded it very well. I really liked that. Thank you.
Thank you, doctor. Yes, we learned a lot today from Dr. Anthony Thomas. He's the Director of Diagnostics of Prime Medical Healthcare Group at Premier Diagnostics. Well, we learned so much about today what is pathology. It's about the science of suffering, and how Dr. Anthony is a very special doctor, because the pathologist results in terms of the diagnostics that they're doing helps detect cancer early. It also helps in terms of precision treatment. What does it mean? Dr. Anthony explained today how there's so many tests to know what cancer type it is, where it is coming from, and what are the specific treatments required to make sure that the cancer gets treated well. We also talked today about what are the ways for you to prevent cancer, and Dr. Anthony shared about number one, loving yourself and taking care of yourself. That's very critical. Number two, about managing stress, because Dr. Anthony shared how our immunity impacts our overall health and well-being. And of course, Dr. Anthony emphasized the importance of having good habits, eating the right food, having the right number of hours of sleep, taking the right food and medicine. It's very, very important overall. Now, if you want to get yourself screened, get the right diagnosis for yourself, there are several packages for men and women that the Premier Diagnostics have. Please visit their website. If you want to get yourself checked, there are many clinics all over Dubai and many parts of the UAE. So visit Prime Healthcare Group so you can understand how they can take care of you and give you personalized health personally. Thank you again. This is Wandaling Tankalupig. Thank you for watching the Cancer Conversations with Coach Wanda. We are streaming live every week on LinkedIn, Facebook, YouTube, Instagram, and Twitter. If you do want to partner with us, please message me or my team at Caltan Social Media Marketing. Or if you want to have your own live video podcast like this and you want to stream it live across all social media platforms, please get in touch with my team and let us discover if we are fit to work together. Thank you and God bless you. And until the next episode.